Many nurse leaders' professional lives no longer has the sense of purpose and excitement that they once craved. Their job demands unpaid overtime, but when it's the other way around and they are the ones who require paid time off or sick leave, it's a struggle. Their work environment feels like a war zone with hostile co-workers and leaders who are unsupportive. Let's explore why nurse leaders are leaving and the surprising plus hidden in plain sight cost of burnout in nurse leaders. If that's you and you want to trade this burnout and frustration for time, location, and financial freedom, stay to the end and I'll show you 3 solutions to this problem. But before we get into it, subscribe now and do me a favor, hit that like button. I've been in nursing for 15 years and what I'm sharing with you today is from my own personal career experience and that of the many nurse leaders I've interviewed over the years. Whilst money is a factor, it's really the biggest reasons why nurse leaders are leaving. They cite lack of respect and recognition as one of the biggest contributing factors to them making the decision to leave nursing. And unfortunately, when I say lack of respect, I mean peer-to-peer. It's not even from upper management. And I suspect that it's created by that culture of nurses eating their young. And from the beginning, when nurses start their career, they are exposed to this environment where older, more mature, experienced nurses are harsh and even hostile to young inexperienced nurses. As these inexperienced younger nurses grow older and become more experienced and seasoned, they still perpetuate that culture, and it leads to a scenario where when we're working with each other, people are not really respecting each other. We also see this lack of respect when it comes to the relationship between nurses and doctors, where doctors assume that they know better and they look down upon the role of the nurse, or they question decisions that nurses or experienced clinicians are making. As one's career advances, there is an innate need to be recognized and appreciated for the work that you do. Unfortunately, within the nursing system, we have not been good at recognizing expertise and the years of sacrifice that nurse leaders are bringing to the table. As a result, it's leaving nurse leaders feeling underappreciated and disrespected. We can correct these narratives as nurses by first refusing to perpetuate the notion of nurses eating their young and instead supporting and really nurturing new and younger nurses so that they can develop the culture of supporting each other, being respectful to each other, and no longer contribute to the creation of a hostile work environment. Healthcare providers need to have a system that actually recognizes experience and expertise that nurse leaders are bringing to the table. This includes taking the time to publicly acknowledge accomplishments and not undermining nurse leaders' authority. The healthcare sector is made up of systems that promote prolonged and unrelieved stress levels. In fact, the amount of stress that nurses go through is classified as an occupational hazard. Every day we are seeing unrealistic workloads, goals which are impossible to reach, extended unpaid overtime, and the expectation to work 12 to 13-hour workdays. Many nurse leaders are even embarrassed to leave work and go home on time because they feel like it makes them seem as if they're not committed to their work. Companies now need to stop promoting and rewarding unpaid overtime through their attitudes. It needs to be normal for a nurse leader to pack up and go home as soon as their workday finishes. Healthcare systems are designed to promote profit over people. For example, in many healthcare organizations, there is a target, a monthly financial target to meet. And we know very well that sometimes nurses get sick, especially when during winter, when there's flu and colds happening, or maybe your child gets sick and a staff member calls in sick. But in some healthcare organizations, you are unable to actually call in and replace a sick staff member because they don't want to pay the extra money that is involved in getting agency to come in. Even though you're having to work understaffed because they're not being replaced, you're still expected to produce the same amount and quality of work. And this puts exceeded amount of pressure on nurse leaders. In my opinion, forcing staff to work understaffed simply because an organization wants to meet financial standards should be illegal. There's lack of adequate resources and support from upper management, and this is leading to low retention of quality staff. Experienced nurse leaders put up with poor financial compensation despite the many years of expertise. This is such an insult to the amount of effort and how difficult it is even to be a nurse, considering that nursing is one of the most difficult professions in the world. The compensation should also match the level of difficulty. Lastly, nurse leaders are leaving when they're unable to grow and expand within the organization. They hit a glass ceiling and it's no longer possible to keep on expanding your area of expertise. As a result, they leave for greener pastures. Patients suffer increased clinical risk due to this nurse burnout and nurse leaders leaving. How many times do we hear horrendous stories of things that go wrong when people seek out medical care because of mistakes, being short-staffed or underskilled? The high staff turnover is contributing to poor leadership in healthcare organizations. On a personal note, the constant stress is leading to emotional exhaustion, and over time this becomes chronic disease conditions such as anxiety and depression and other health scares. Nurse leaders miss out on time over the years with kids and partners, leading to broken relationships and even divorces. Once the kids grow up, you'll never have them back at home. As a result, I see nurse leaders now wanting to buy time back by having more freedom and flexibility and spending time with the grandkids. There's a loss of a sense of purpose, and this is one of the worst because as human beings, we derive a lot of satisfaction in our lives from our careers and the ability to help those that are around us through the work that we do. With nurse burnout, you lose that sense of passion that you once had when you started out. It creates a scenario where you dread waking up in the morning and you hate your job. But then you still go because you convince yourself that this is what adults do and you have to do it in order to get that steady paycheck. Lastly, nurse burnout leads to limited income because it takes away your ability to go after and actually pursue better opportunities than where you are right now. Over the long run, you earn less than your peers, and retirement might even come knocking before you have the ability to own property or have investments in place. The first solution to the nurse burnout problem is self-care. I'm a proponent and I advocate for self-care, and I used to teach and train new nurse managers to take care of themselves and fill their cup and do all these amazing things, and add to that time management skills as well, until I realized that when you find yourself in a job where the system is broken, then self-care does nothing much in the long run. So you can self-care, have enough sleep, every day as much as you can. Stop responding to emails at 5 p.m. But if you're in an organization that is hostile to you and does not respect those boundaries, you get tired over time. That being said, take care of yourself, do your self-care, even if you're in a place where you feel like you've been trying to do it and it hasn't been working. Don't give up until you have a better and more lasting solution. 2, find a new opportunity. Don't be afraid of quitting or leaving a job that is no longer working for you. As of today, we're no longer encouraging people to suffer in hostile work environments just because they want to get a badge of honor that they have stayed in the same job for 50 years. That's no longer happening. In fact, studies show that people who change their jobs often earn more. I've experimented with being a nurse manager, nurse educator, creating, developing, and implementing policies and procedures. And even though that required me to leave certain jobs and find the next opportunity, there were so many lessons involved, and I'm so glad that I did it. So be gracious on yourself. Go ahead, explore new opportunities because they are there. If you are so worn out though, and here's how you recognize that you're worn out. If you're so negative, resentful of your job right now, you've got nothing positive to say, you're probably really anxious and depressed, then I do recommend just taking a bit of a break. Maybe give yourself 2 weeks, a month, or 2 months based on what you can afford. Lastly, start a business, work independently. Non-nurses are making millions of dollars in nursing businesses and employing burnt out nurses to work for them. Why don't we flip that script as nurses and actually start these businesses ourselves? If you don't want to lose income, you can start as a nurse consultant. That's what I did. It's the quickest way to just translate your expertise into a profitable, sustainable business. And if that's you, ready to explore the consulting path so that you can ditch the burnout train and regain control over your time, income with freedom, then book a free consultation with me. My calendar is in the link below. I also created a video for you. So if you're still sitting there saying, I don't know what business I would start, then watch this video. It gives you $14 million ideas that $1 million businesses that nurses can start. Whatever you decide to do, change your situation for the better. Let me know in the comments what was your biggest takeaway from this video, and remember to subscribe and hit that like button.